Codyssey Hackathon submission. Project title: Vital, Virtual Interface for Treatment and Assessment in Life Care. Have you ever wandered from hospital to hospital, from one diagnostic center to another, trying to find out what's really wrong, only to be asked to repeat the same tests again and again because the previous reports weren't compatible or accessible? Have you ever waited weeks for results or carried stacks of medical files just so the next doctor could understand your case? Now imagine this multiplied across millions of people every single day, with each hospital using its own database, each lab storing results in different formats, and no system that connects them all. This fragmented data isn't just inconvenient, it's dangerous. It delays diagnosis, increases costs, and prevents early detection of diseases that could have been managed or even prevented. In India alone, 1 in 4 adults suffers from hypertension and 1 in 5 from diabetes, yet fewer than half of these individuals receive proper or timely treatment. Why? Because medical information is scattered across hospitals and clinics that don't talk to each other. Patient data insecurity and limited research access mean the wealth of healthcare data remains untapped. Researchers and AI developers struggle to obtain real-world datasets essential for building early warning tools and predictive models. The consequences are severe. Silent disease progression goes undetected, treatment is delayed or inappropriate, and millions suffer preventable morbidity and mortality. This is where Vital, the virtual interface for treatment and assessment in life care, comes in. Our vision is simple yet transformative: to unify healthcare data, make it accessible and secure, and empower doctors, patients, and researchers through one connected, intelligent platform, providing insights needed to act sooner and better. Our solution unfolds in 3 stages. Stage 1: creating a unified hospital patient database equipped with interactive dashboards for easy access. Stage 2: adding AI and machine learning modules that predict early onset of diseases by calculating personalized risk scores. Stage 3: sharing de-identified data with researchers through a controlled, API-based interface to fuel medical discoveries, all while maintaining privacy and security. At its core, Vital aggregates electronic health records from multiple healthcare providers, normalizing and de-identifying data to ensure privacy and compliance. Patients and doctors access their relevant records via user-friendly interfaces, and hospitals sync daily updates to the central DBMS server. The ML models analyze aggregated data to assign personalized risk scores for diseases such as diabetes, cardiovascular conditions, kidney and liver diseases. These scores aid clinical decision-making and patient monitoring. Finally, anonymized datasets and model outputs feed into a research-only portal, accessible under strict permissions. In Stage 1, we built the core backend of our hospital patient system using Django's MVT architecture, which ensures a smooth flow from data to decision to display. The model layer defines 3 key entities: patients, doctors, and observations, designed following the FHIR-HL 7 Healthcare Data Standard for structured interoperability. These models maintain bidirectional relationships, allowing doctors to access and update patient observations efficiently. The view layer handles all the application logic and data formatting, serving as the bridge between the database and user interface. It ensures that every data request or update follows the same structured pipeline, keeping our system modular and scalable. Finally, the template layer powers 2 dashboards: the doctor's dashboard, which provides access to patient records and supports new observations, and the patient's dashboard, where users can securely view their own medical data. This architecture forms the foundation for integrating machine learning in the next stage, enabling predictive and intelligent healthcare insights. This brings us to our AI pipeline. To develop our model, we used the NHANES dataset from CDC. The data was subjected to all standard pre-processing steps like imputation, normalization, and encoding. Next, we carried out feature selection for 4 key disease groups: diabetes, liver conditions, weak or failing kidneys, and cardiovascular diseases. We experimented with 3 strategies: correlation-based feature selection, hybrid selection combining correlation and XGBoost, and hybrid selection combining correlation and random forest. This helped us narrow down to 8 key features per disease that showed the strongest predictive relationships. For classification and risk score computation, we compared 3 different ML models: XGBoost, random forest, and logistic regression. Their performance was evaluated using metrics such as ROC, confusion matrix, and F1 scores. Upon comparison, we found that hybrid feature selection using correlation and random forest produced the most biologically relevant feature sets, while XGBoost consistently delivered the highest accuracy and stability in disease prediction and risk estimation. Here's a snapshot of our diabetes prediction model results. The selected features include both predefined clinical parameters and those identified by the model's algorithm. The correlation matrix and feature importance histogram show clear clustering of influential variables, and the model achieved an impressive AUC of 0.97, validating its reliability and predictive power. In Stage 3, we extended our system to support secure and standardized data access for clinical research through a REST API pipeline. The DBMS server stores structured patient, doctor, and observation data, along with the research analyzed data from our AI pipeline. It ensures interoperability with existing hospital systems and enforces strict access control policies for different user roles. The REST API acts as a controlled gateway. It parses and serves observation data through standardized endpoints while implementing token-based authentication. All sensitive information, such as names and contact details, are de-identified before transmission, and encryption through TLS ensures complete data security in transit. Finally, the researcher interface provides read-only access to de-identified datasets. Every request follows HIPAA compliance standards and uses token-based authentication for approved researchers. This architecture enables scalable, privacy-preserving data sharing, allowing researchers to extract insights from real-world clinical data without compromising patient confidentiality. Let us now visit our website and explore its features. Currently, the website is hosted on the Heroku Cloud platform, ensuring secure, scalable, and efficient deployment. The entire system is built using the Django framework of Python, which provides strong back-end capabilities and seamless integration with machine learning models. The interface works smoothly on desktops, tablets, and mobile devices alike. Here, we have the home page. The Vital logo represents connection and care, a bridge between technology and healthcare. The website has been designed to be intuitive, minimal, and user-friendly, making it easy for patients, clinicians, and administrators to navigate. Let's start by registering as a patient. Users can create a new account and log in securely. Clinician accounts, however, require administrative authorization for security and data protection reasons. Once logged in, we arrive at the patient dashboard. All medical records are displayed in chronological order, so users can seamlessly track their medical history. Clicking on an individual record reveals detailed information about that specific observation, including vitals, test results, and doctor notes. Next, let's explore the early onset disease prediction model, one of the core features of Vital. This AI model is trained to work with commonly available clinical data. No expensive marker-based or specialized tests are required. It analyzes general health parameters such as age, blood glucose, blood pressure, and more to provide a risk assessment for disease onset. Let's enter the data and click on Get My Risk. The system instantly predicts the result, whether the user falls into a normal or high-risk category. For demonstration, we'll show both cases: one patient in the safe range and another flagged as high risk. If a user is identified as high risk, The platform immediately advises them to consult a physician, thus preventing serious health outcomes, helping reduce preventable casualties, and supporting early medical intervention. Now, let's log in as a clinician. This account has already been authorized by the administrator. The clinician dashboard offers a completely different view. Here, clinicians can view a list of their assigned patients, review their medical histories, and check if any patient has performed self-assessment using the vital model. They can also add new observations, update existing records, and prescribe medications directly through the platform. Since this is a beta version, we've included only the core functionalities required to establish the system's workflow. Future enhancements will include features like automated medication suggestions, secure prognosis storage, and real-time patient monitoring dashboards. Finally, let's look at the administrative panel. Administrators have the highest level of control over the platform. They can create or remove users, clinicians, and researchers, and manage access permissions. Most importantly, they can also generate authorization tokens for approved researchers to access de-identified clinical datasets through the integrated REST API, promoting open and ethical biomedical research. All administrative actions and sessions are securely logged and monitored for complete transparency. Who stands to gain from Vital? Well, the answer is everyone involved in healthcare. Hospitals and providers benefit from unified data and AI-driven support that streamline clinical workflows and reduce costs. Clinicians receive a comprehensive, longitudinal view of patient health and predictive insights. Patients experience continuous, personalized care with early warnings and personalized treatment plans. Researchers obtain de-identified, standardized datasets to develop new models and discover novel biomarkers. Public health agencies can monitor population-level disease trends in real time for evidence-based policy. Biotech and insurance companies can leverage real-world data for improved drug trials and dynamic risk profiling. Vital strengthens every link in the healthcare chain, creating a ripple effect of better outcomes. The digital health market is booming, valued at around $650 billion globally, with a 15 to 20% annual growth rate. India's healthcare industry alone accounts for about 5% of the national GDP, and the demand for interoperable AI-based solutions has never been higher. Our MVP is already demonstrating viability. It securely shares data, offers real-time visualization, and soon will fully integrate predictive AI, synchronize with existing electronic health records, and support research exports. Unlike niche products like Practo or Healthify Me that focus on limited services, Vital is designed as a security-first, fully integrated, AI-enhanced platform, bridging the gap between frontline patient care and cutting-edge research. To grow sustainably, we've outlined a phased rollout. Pilot with 2 to 3 medium-sized hospitals to validate AI models for key diseases. Expand integration to a wider hospital network or state-level health system. Incorporate wearable and app-based health data for richer real-time analytics. Establish governance and legal frameworks for nationwide rollout. And finally, a scalable, interoperable platform supporting clinical, research, and public health stakeholders. Of course, no great innovation comes without its hurdles. One of the major challenges we encountered was data heterogeneity, diverse formats, inconsistent variables, and missing information. Coupled with this was the lack of balanced and comprehensive training data, which made model optimization difficult. These very challenges underscore why Vital is essential. It's designed to standardize, unify, and make healthcare data interoperable so that no valuable information remains underutilized. Moving forward, we also plan to strengthen our security and privacy framework, ensuring complete compliance with data protection laws, and to proactively address any legal or ethical challenges that may arise as we scale toward real-world deployment. Looking ahead, we imagine Vital as the central nervous system of healthcare worldwide. Our future plans include integrating wearable and IoT data streams for continuous health monitoring and using federated learning, so hospitals can train AI models collaboratively without exposing raw data. We want to create population-level dashboards for early policy planning and bring telemedicine into the fold, extending predictive analytics to even the most remote patients. Ultimately, Vital aims to shift healthcare from being reactive, treating disease after it strikes, to being proactive and predictive, turning isolated records into a living, learning network of health. We believe Vital can redefine how healthcare is delivered, a future where data doesn't just sit in silos, but truly heals before disease can take hold. Vital, healing powered by data. Thank you.